Order, order. I call Max Wilkinson to move the motion.
Thank you, Mr. Chope. It is a pleasure to serve under your chairmanship. I'll start by noting that the honourable member for the North Cotswolds gives his apologies. He was due to be here, but he's counting the votes in another place at the moment in an important internal election. But he wanted me to start by saying that he gives his full support to the comments being made by me and others in support of maternity services in Gloucestershire. So I hope the Hansard will reflect that. It is not controversial to say that NHS services across the country are struggling. One of the services that impacts all of us at least once in our lives is maternity care. This service is at the heart of women's healthcare. It must be treated with the utmost seriousness. Pregnancy and childbirth is a special moment for families. It is something that I cherish as a memory. Obviously, I was not pregnant myself, Mr. Chair. It is something to be cherished by all, but for pregnant women, it can also be an extremely stressful experience. And if there are failures in the system, the consequences can be dire. Some of those consequences were laid bare in the recent Panorama documentary into maternity services in Gloucestershire. In that documentary, we heard too many harrowing stories. Brave whistleblowers from within the system and brave mothers told their stories, and indeed one brave father told the story too. And those stories were told in the most heartbreaking terms, and they will stick with me for as long as I live. Gloucestershire Hospital's NHS Foundation Trust apologised for those failings. It has invested in increased staffing. It's worked to reduce staff turnover, and it has made changes to leadership in maternity care. But so much more needs to be done. The current status is that the service at Gloucestershire Royal Hospital was rated inadequate in 2022 and again in 2023. The findings of a further inspection earlier this year are still awaited, but a Section 31 Safety Enforcement Notice was served in May. Cheltenham's midwife-led Avita birth unit serves a large chunk of our county. It was closed for births in autumn 2022, sometime before 6 of our county's 7 members of Parliament were elected. The closure was due to a shortage of midwives. The reorganisation by the Hospitals Trust was carried out to ensure that one-to-one care across Gloucestershire's wider maternity services could be achieved. It is an entirely understandable response. Nobody would want to put mothers and babies at risk. However, we were told these were temporary measures. 2 years down the line, they are still in place, and that is not an acceptable situation for people in our county. The NHS Hospitals Trust suggests that there will be no reopening for births to the Cheltenham Avita Centre before April 2025. But even then, nothing seems certain. The Trust states it is committed to reopening the centre when it is safe to do so. However, the Byzantine way in which the NHS sometimes works means that it is difficult to work out who will be the ultimate decision maker, and sometimes decisions on resources are made by the ICB rather than Hospitals Trust staff, and this collaborative process makes it difficult to work out who must be held to account for statements that have been made in the past.
Would the Honourable Gentleman give way?
I will.
Can I first of all commend the Honourable Gentleman for Cheltenham for bringing this forward? He and I and everyone in this room will be very aware that the difficulties in Gloucestershire are unfortunately replicated in every part of the United Kingdom, certainly in my part of it as well. And while at the same time we have some of the best staff in the world in our maternity wards, and we rightly recognise the good work that they do, but they are being hampered from doing their job and caring by understaffing, budgetary restraints, inability to get support from senior staff, and this needs, I believe, a root and branch change across all of the United Kingdom. Would the Honourable Gentleman agree to that?
I would. The Honourable Member for Strangford makes a strong case, and I will come on to some of the evidence that's been given by the Royal College of Midwives later, because they've done some really important studies into the stress that midwives are put under in the system. I'll move on to Stroud, and the Honourable Member for Stroud is sitting opposite. In Stroud, 6 postnatal beds were closed around about the same time as the closure to new births at the Cheltenham Avita Centre. The reason given by the Trust is that the temporary closure would consolidate staffing across the county and provide a safer level of care for births across the whole of Gloucestershire. I'm certain the Honourable Member for Stroud will have more to say on this if he's called to speak later on, and I'm pleased to see him there today. In terms of our county, the 6,000 families who rely on our maternity services each year, they view this as a significant downgrade in service, and it is a cause of worry for a large number of families. It is clear that these services can only reopen when staffing levels improve. At the moment, the Trust says it is around 13% below the staffing level required to return to the previous level of service, with Cheltenham open and the beds reopened in Stroud. However, the nature of midwifery means that quite a lot of the midwives will be off on maternity leave themselves at any one time. And indeed, I will come on to talk about the stress that midwives are under and some of the causes of that, which has led to a larger than in the rest of the NHS proportion of midwives being off for a significant period of time each year. Research into what is driving the recruitment and retention crisis exposes the scale of the challenge that we face in Gloucestershire and indeed across the rest of the country. Recruiting to a trust under a Section 31 safety notice, we are told, is even more challenging than it is elsewhere. Midwives already under significant pressure are subjected to additional strains in the form of monitoring and bureaucracy, and that can have an impact on staff morale. Of course, monitoring and bureaucracy is important when we're trying to get trusts out of safety notices. However, we can't look past the fact that this makes it more difficult to overcome those recruitment challenges. But if that were the only barrier, it would be somewhat simpler. However, the Royal College of Midwives conducted a randomised survey of weekly hours worked by midwives and maternity support workers. The findings were absolutely shocking. They found that the staff surveyed reported a collective total of nearly 120,000 unpaid hours in that week. This is a stark illustration of the demands placed on frontline NHS staff. Those people go above and beyond in a system that appears to be falling apart at the seams. It is no wonder that the Darzai Review reports that there is a high rate of sickness absence among midwives. That's 21.5 days per year per midwife. The most common reason cited for this absence was anxiety, stress or depression, or other psychiatric illnesses. Midwives go into the profession because of a commitment to the health of women and babies, and a commitment to give care at a critical moment, and to be part of a joyful moment in so many families' lives. That they are collectively suffering such high levels of stress tells us just how badly wrong the system is going. I will.
As the Liberal Democrat spokesperson on mental health, I think we should acknowledge and pay tribute to the NHS staff in general, specifically midwives, because we know that one factor of that causes stress and is just overwork, and we're also aware that the NHS very much runs on goodwill, people working extra hours, unpaid hours, and it has been the normal for many years, but it's not sustainable, and we need to personally pay tribute, but acknowledge the support they need, the staff, from a mental health point of view.
Absolutely. And my honourable friend makes a really strong point. Employee assistance schemes have a strong role to play here, and in the NHS, I understand, there is, in general, quite good support. However, it is a massive struggle when people are working so many extra hours to actually ensure that they get the support that they need. And in the case of midwifery, it is a stressful job. This is a life and death matter in many circumstances. But there is a clear and obvious link between the extreme overwork identified in the RCM survey and the findings of the CQC. If staff are working so many extra hours, it is obvious that they're going to suffer. Gloucestershire Hospital's NHS Foundation Trust has identified staff turnover levels and low morale due to the workload as significant factors. The Darzai report also, by the way, calls for a shift away from care in centralised hospital settings and towards communities. And it states that that is a likely route towards the recovery of our health services. That being the case, and with a minister in the room, I say there is a clear argument for restoring Cheltenham families' access to a fully functioning birth unit in our town as soon as is safely possible. And I'll then add 3 questions to the Minister, if she'll be so kind to answer them later. Firstly, what is the government's position on seeking to reinstate maternity services in places like Cheltenham and Stroud, which have been recently downgraded? Secondly, what will the government do to address the ongoing recruitment and retention crisis in midwifery? And thirdly, in specific cases such as Gloucestershire's, where a Section 31 notice is exacerbating recruitment and retention issues, what can the government do to help local trusts improve their staffing position? I understand on that point that there are some examples from around the country where trusts have been supported to pay higher wages and salaries to make sure that midwives can be properly recruited and to overcome that shortage.
Would
and I wonder...
friend give way?
Of course.
Thank you very much.
Okay.
My local hospital, which is the Royal Berkshire Hospital, that's where my 2 children were born, and many of our friends' children were born there. They have recently received an upgraded rating of good from the Care Quality Commission. They're one of only 9 organisations out of 131 that were looked at over the last year or so to get an upgrade to good. So I'd like to commend the Royal Berkshire Hospital leadership and their staff for their diligence, dedication, and congratulate them on that result. Does my honourable friend agree?
Intervention should be short. If the honourable gentleman wishes to make a speech, he can do so later. But,
Right.
Okay. So let's hear the response to that intervention.
Thank you.
I'm sure I would agree with whatever my honourable friend was about to say. He was making the point, I think, that it is easy to be down on our NHS and its staff, and that is not the purpose of this debate at all. The purpose of this debate is certainly to ensure that we are giving the support that's needed to our midwives and other NHS staff, and indeed NHS managers who are often maligned, but in line with other NHS staff, we know work very long hours and are in it for the betterment of health services. And I'm on to my final point now. So I must, on a personal note, offer wholehearted thanks to the staff at Gloucestershire hospitals who were there for my wife and I when our daughter was born in Gloucestershire Royal Hospital in 2022. It was an important day for my family and for the country. When we went into the operating theatre for the C-section, this country had no Prime Minister. And when we came out, we had my daughter Elodie and we had Liz Truss. It's a memory that will live long for me. And I will give particular thanks, if I may, to Fiona Liddell, the midwife that gave us the most care during my wife's pregnancy, as well as all of the doctors and nurses and healthcare workers who helped make the experience so joyful for us. Thank you, Mr. Chope.
The question is that this House has considered maternity services in Gloucestershire. I'm now going to call Alex McIntyre.
Thank you, and it's a pleasure to serve under your chairmanship, Sir Christopher. I congratulate the Honourable Member for Cheltenham for securing this debate and bringing attention to the challenges facing our maternity services in Gloucestershire. I must declare that as well as being a very important subject for my constituents, this is a personal subject for me, and I'm privileged to be able to contribute my family's experience to the debate today. My little boy, who turns 1 later this month, was born in the county and spent his first night at Gloucestershire Royal Hospital. While it's clear there are challenges facing our maternity services and improvements are required, I want to start by sharing with you the positives of our experience. Firstly, the support and care provided by the community midwifery team was second to none. Our midwife, Lindsay, was with us throughout our journey and was even on call the day my wife went into labour, so she was there to deliver our little boy. Lindsay looked after us throughout my wife's pregnancy, answering our questions and signposting us to courses that would enable us to become advocates for the birth that we wanted. From the outset, our experience was positive, although I know that this is not the case for all families, and it's essential that their voices are heard in this debate today. Being able to choose where you have your baby is so important. Having conducted our own research, we decided that we wanted to give birth in a midwife-led unit. There are, of course, differing views on this, but that was our choice, as we had read that midwife-led care can lead to fewer interventions. At the time in Gloucestershire, Stroud was the only reliable option, as Gloucester's midwife-led suite was frequently closed due to a lack of available midwives. As part of our maternity care, we were invited to Stroud Maternity Unit to visit the birthing suites so that it was familiar on the big day. Now, I understand this is very important, as stress produces hormones which can actually stop or slow down your labour. However, once my wife was in labour, our plans were very nearly changed at the last minute due to a lack of midwives at Stroud Maternity Unit, stress we could have rather done without. It highlighted to me the great reliance currently placed on midwives working overtime to cover shifts across Gloucestershire. However, with Lindsay on hand and with minimal intervention, the birth itself was relatively quick and our baby boy was born. Truly the best moment of my life. Unfortunately, my wife needed an operation after birth, so we were transferred to Gloucestershire Royal Hospital, wife and baby in an ambulance, me following behind on what was following the best moment of my life, the scariest car journey of my life. The care we received that night was exceptional. Not only were my wife and baby looked after, but the unbelievably compassionate team looked after me too. Something as simple as a cup of tea and a reassuring chat when I'd been up for 48 hours and left on my own with a newborn baby was transformative. Unfortunately, things weren't so positive the following morning. All was well with mum and baby, and we were told we'd be going home in the afternoon. I went home to grab a quick shower, get some shopping in, and make sure the house was ready for our new arrival. I was gone for at most 2 hours. When I got back, my wife told me she'd been visited by over 10 different people over the course of those 2 hours. Pharmacy assistants, nurses, midwives, with each adding new information about her discharge each time. She'd just had a baby and undergone surgery under general anaesthetic, so there were instructions for her and our baby. None of them were written down. For her, it was overwhelming, and something as simple as written discharge notes would have made a huge difference. After we got home, our baby unfortunately developed some issues with his breathing. Now, this can be quite normal, I understand. Babies are used to breathing fluid and getting oxygen via the umbilical cord. But as new first-time parents who'd been awake for 60 hours, we were worried, and there was no one to turn to. We phoned Stroud Maternity Unit, where we'd given birth, but their postnatal unit is closed, as the member for Cheltenham rightly pointed out, due to a lack of midwives, and they advised us to call 111. We called 111, and they told us we had to call Gloucestershire Royal's delivery unit. They told us that we had to call Stroud Maternity Unit because that's where we had given birth. Back to Stroud, back to 111, no out-of-hours GP service available. The only solution, we would have to go to A&E. Now, taking a newborn baby to A&E on a Saturday night is an interesting experience. The staff in A&E were wonderfully friendly, but their procedures limited them in what they could do. He couldn't be seen by the neonatal unit as we'd been discharged from the hospital. He would have to go to the paediatric unit, which the staff warned us was rife with COVID. All we wanted was someone medically qualified to listen to his chest and let us know he was all right. There must be so many parents in a similar position, learning the art of being a parent for the first time and needing that little bit of assurance that their baby gasping for air is going to be okay. We need to find a better way for these parents to access that care. Overall, I have to say a huge thank you to the team who looked after us from the early days of pregnancy right up until our son was born. How lucky were we to have our community midwife there at the birth, the person that we'd grown to know and trust. But in a way, this points to another problem. Lindsay is just one of many midwives across the county being pulled from the community to fill gaps in midwifery services. Across Gloucestershire, vacancies and turnover rates in midwifery services remain high. This increased workload is causing low morale, with the workforce struggling with the level and pace of change required to the service. Community midwives like Lindsay regularly find themselves on call when too few midwives are available at midwife-led units and hospitals. Right now, there are vacancies for 32 midwives in Gloucestershire. That's 13% of the workforce. When we take into account sickness and maternity leave, that figure rises to 63 full-time equivalent vacancies. It's no wonder midwives like Lindsay are being asked to fill the gaps. But there's more, and as the Honourable Member for Cheltenham pointed out, the Royal College of Midwives estimates that across the UK, midwives give more than 100,000 hours of unpaid time to the NHS every week to ensure the safe running of services. Whilst no one could doubt the dedication and compassion of these incredible midwives, this can't be right. We cannot continue to rely on the commitment of midwives to their vocation to fill these gaps. If midwives are working more than 100,000 hours of unpaid overtime a week, it's inevitable that services will be affected and that the safety of mothers and their babies will be put at risk. Midwives are being driven from the profession because the work and the pressure of work is just too much. No wonder my wife left hospital with no written discharge notes. Where was the time left to write them? Whilst our experience at Gloucestershire Royal was largely positive, others have not been so fortunate. Many of you will have seen the harrowing instalment of BBC Panorama that aired in January of this year, which focused on maternity services in Gloucestershire. The programme included the tragic deaths of the mother and 2 babies who died at the hospital between 2019 and 2021. Feedback from staff suggests that chronic staffing issues and a poor culture where midwives felt unable to speak out about unsafe conditions played a large role in what were avoidable deaths. We also need to ensure that in a diverse city like Gloucester, that all residents, including those for whom English is a second language, can access the care that they need. The recent CQC inspections of services in Gloucestershire have also been very concerning, and Gloucestershire Royal Hospital was issued with a Section 31 enforcement notice by the CQC earlier this year. I raised this with the Chief Executive of the Trust in my meeting with him in my first few weeks as the new MP for Gloucester, and I understand that the Trust has already made progress on its improvement plan, and I will keep a close eye on that on behalf of all Gloucester residents. Earlier this year, the CQC published the National Review of Maternity Services in England. They reviewed 141 units across the NHS and highlighted widespread issues with staffing, buildings, equipment and safety management processes. There are many deeply troubling takeaways from this report, but what stuck with me is that the CQC's stark warning that across our maternity services, preventable harm is at risk of becoming normalised. The last Conservative government pushed our maternity services, our midwives, to the point where preventable harm could become a routine consequence of understaffing in units and on wards up and down the country. We cannot accept this for the future of maternity services in Gloucestershire or the UK. I urge the government to ensure that maternity services are given due attention when considering the Secretary of State's 10-year plan for our NHS. Staff shortages are not the only issue we need to address, but it is clear that they are fundamental to the challenges our maternity services face in Gloucestershire and across the country. This government has committed to training thousands of new midwives. We must honour that commitment to ensure giving birth in the UK is safe, that parents have choice, and that midwives feel supported and valued for the incredible work that they do. Thank you.
Rising, Cameron Thomas.
Thank you, and it's an honour to serve under your chairmanship, Mr. Chope. In 2021, my daughter was delivered by caesarean section following a complicated pregnancy. Thanks to the diligence of the delivery team, which included English, Indian, Italian, South African and Spanish experts, we were spared the trauma which too many parents endure, and took our daughter home 24 hours later. I cannot thank those professionals enough for their care and their application of expertise. The midwifery profession and those who join it should be celebrated in this House, as they should across the country. I would like to provide some national context to the issue of midwifery in Gloucestershire, as have my honourable company. Against significant budgetary constraints in the last decade, the NHS workforce has increased by 34%, whilst full-time midwife posts have risen by only 7%. In that same decade, caesarean section deliveries, like our own, have increased by 10% to 23%, meaning that mothers and babies stay longer in hospital and require additional care by midwives. A Royal College of Midwives survey in March 2024, as has been echoed by my honourable friend, recorded that nationally midwives and maternity support workers carried out 120,000 hours of unpaid work in a single week. My ex-colleagues across the Royal Air Force will tell you, when you continually expect more of a diminishing workforce, both the workload and the mental load increase on those who remain, until ultimately they leave or they break. Mistakes become more commonplace. Let us acknowledge the unique emotional load carried by our midwives, whilst they carry the workload of our national shortage of 2,500. The inspection of Gloucestershire maternity services in April 2022 makes for concerning yet predictable reading, though I am pleased, as is the Honourable Member for Gloucester, to have received assurances from the Chief Executive of Gloucestershire Hospitals NHS Foundation Trust that improvements have and continue to be made. I look forward to a full debrief on the report which will follow the external investigation into Gloucestershire maternity care. It must be transparent and retrospective action must take place accordingly. This backdrop creates an additional pressure for Gloucestershire maternity care as we look to attract newly qualified midwives to our beautiful county. My call to graduating midwives, as it is to those already in post, is help us get this right and be a part of the success story. The outcome of our efforts must be the permanent reopening of birthing units at Cheltenham and Stroud. Local efforts will only take us so far. Page 98 of Labour's 2024 manifesto pledged to train thousands more midwives. I am sure that this drive will enjoy cross-party support, and I invite the Minister to press the Chancellor to include a funded plan to train thousands more midwives in the autumn budget. Thank you.
The member for Cheltenham for calling this debate. Maternity in the Stroud area has been a very big issue for the last couple of years, particularly. I'd just like to say that I've been a GP for 30 years. I've been partaken in helping with antenatal and postnatal care, and indeed intrapartum care for 6 months, which was the hardest work I've ever done in my life. And I also delivered my second daughter in a Worcester hospital. And I know, and I've worked with fabulous midwives. Midwives actually are the absolute key to maternity services, as we've all been discussing. But actually they run maternity services. They occasionally call doctors in for other reasons, but they have to be central and they have to make the decisions around women. So this is one of the reasons where I am so promoting the Stroud Maternity Unit, because of midwife-based units, as Alex has already said, have lower levels of intervention and have better outcomes for babies. So that's the sort of thing I was going to say. And as many people have already said, there's a key problem here, which is lack of midwives. And I don't think we should shy away from that at all. But I wanted to also talk about a number of other issues, if that's okay. So one of the things that seems to have gone from this discussion is the choice of women about where they give birth. We seem to have reduced that choice down to virtually Gloucester Royal, really. And although Stroud Maternity is open for intrapartum care, the fact that it doesn't have its postnatal beds means that women generally are choosing it less, which is a pity, because it's a fantastic place to give birth and has a low intervention rate. There's also something about equity and equality that seems to have been lost recently as well, and we need to get that back into the decision-making process. Another thing I thought I'd talk about, maternity care is actually quite a lot longer than just where you give birth. So one of the things, and I'd just like to outline where these interventions take place. So preconception and antenatal care tends to get done in GP surgeries by community midwives with the help of GPs. Intrapartum care can be at home, and there is a small proportion of people that do give birth at home, and then in midwife-led units like Stroud Maternity, and then, of course, in either midwife-led units at Gloucester Royal or consultant-led units at Gloucester Royal as well, and then in Cheltenham as well. So they're the possibilities. In terms of postnatal beds, the only choice you've got at the moment is Gloucester Royal. There's no other option in Gloucestershire for that. And so it's either you go for your postnatal care there, care, or you have to go home and have a community midwife. And then the last part, I always think, of the whole maternity service is the 8-week check of the baby by the GP, which I've done thousands of in my life. It's one of the best things I ever do, and you can check babies for problems, and you can talk to mums about not sleeping and all the other issues there. So that's the sort of the whole rounded nature of maternity care. I want to just talk about Stroud Maternity, because that's what I know about most, and this is what we're missing most. So first of all, it's a very much loved and valued service in Stroud, and we are missing the 6 closed beds, postnatal beds. As I said, it's a standalone midwife-led unit, which is unusual in this country, and it's a shame it's unusual because it's a really good place to have intrapartum care. So it's something that I'm really trying to promote. The numbers are that we have 1,000 live births in Stroud per year. Only about 300 at the moment take place at the Stroud Maternity Unit. But there's, as I say, lower levels of intervention, increased maternal satisfaction, and for that reason, we must get these beds back open. The beds have been closed since 2022. I wanted to make a few points about postnatal care, because often people say that postnatal care, oh, it's a luxury, but we can't really afford it. This is not a luxury. There's quite very, very good evidence for certain families, certain mothers, that good postnatal care saves a huge amount of money later on. It's about making sure that the baby and the mother bond properly. It's making sure that breastfeeding starts properly. It's making sure that they have a couple of days, really, away perhaps from a number of other children and just properly bond and learn how to look after babies. So I think a lot of my colleagues say, well, postnatal care, we don't really need that. But we do need that. And if we lose it, it will cost the country more, but it's also part of the whole maternity services. So that's the first thing I would say. The second thing I would say is that CQC have stipulated various things. Now, CQC are about safety, which is none of us can argue about. However, some of their decisions, I feel, do not actually make sense, and all they do is give safety to the organisation and not to the mother. So, for example, they're closing the postnatal beds because they insist on having 2 midwives on the unit at all times, and that makes it safe. So by closing the postnatal beds, all these mothers have to go home. So are they safer at home, or are they safer at hospital with maternity care assistants and with other nursing staff? And I would say to you that the safety of the mother is better served with these postnatal beds open, even if there's just an on-call midwife as a second midwife. So all I would say, I want to just slightly question the logic of CQC, and we must go back to them. So one of the things that I will be doing after this meeting is I will be writing to the inspectors and arranging a meeting with them, because we must consider the safety of the mother and the child first. It's not about sort of covering the organisation and making that safe. It's about making the mother safe. So I would really iterate that as well. The other thing that we have been doing, the League of Friends at Stroud Hospital in general and at the Maternity Hospital are fabulous, and they've been providing extra services for postnatal and antenatal mums for some time. And so we now have a sort of interim plan where we're going to open a sort of a day hospital in the maternity unit. So at least mothers can come, they can have a bath while someone else looks after their baby, for example. They can have advice from health visitors and midwives. And so that's a sort of interim, but I don't want to say that's a good replacement. We must get those postnatal beds open. And so I'm also due to meet with the Maternity and Neonatal Voices Partnership, who are a crucial agent here as well, that we must talk to. So just drawing to a summary, and what obviously in terms of what we need to do here is we need to train and crucially retain more midwives, because we have trained quite a lot of midwives who have almost immediately left the profession, as you were saying, because of stress. So we need to get a better working arrangement, and I'm looking forward to the Minister outlining plans for training thousands more midwives. We need to review CQC safety and make sure that the standalone nature of midwife units are fully understood by the CQC. We also have to make much more flexible midwife working, so you can have on-call type systems for these standalone units where a second midwife doesn't need to be present, but they need to be available to be called in. I've talked to midwives about this and they seem to be very happy to run that type of service. And then we need a commitment from the ICB and the GHFT, the Gloucester Hospitals Foundation Trust, to reopening all the 6 postnatal beds at Stroud Maternity Hospital. Thank you very much.
Yeah, Young.
Thank you, Mr. Chair. And I'd like to thank the Honourable Member for Cheltenham for securing this debate. Although my constituency is in South Gloucestershire, which I've spent many years as a unitary councillor explaining is a unitary, not a district of Gloucestershire, some of my constituents access health services north of the border in Gloucestershire. And the serious concerns about maternity services in Gloucestershire are causing people to travel the other way, across the border and through into Bristol, where many of my other constituents use services. So this does have a significant impact on my constituency. I welcome this debate too because I know from my own experience the lasting impact that overstretched maternity services can have on outcomes for mother and baby. I had the misfortune to give birth in a hospital that had too many simultaneous emergencies. Even now, more than 20 years later, I can vividly remember the feeling of abandonment, the horror of my newborn baby being rushed to NICU, the panic as I felt myself losing consciousness and a team of doctors rushed into the room to deal with me. It was many hours before I was reunited with my son, 6 months before he was discharged from consultant care, and more than 2 years before I was. My experience of early motherhood was blighted by trauma and pain and the seemingly endless follow-up appointments for both of us with a huge range of specialists. 5 or more years later, doctors still considered his birth relevant to my son's health. And sadly, for some families, the outcomes are far, far worse. I cannot begin to imagine the pain of losing a child or a partner in childbirth, but for some, this is the tragic reality. How hard it must be to bear when there is a possibility that better care may have changed that reality. And let's not forget the impact on the wider family, as the Honourable Member for Gloucester mentioned, the experience, the support he felt from staff when his son was born. They too can be traumatised by what they see their family going through. So I do really understand how important it is to have good maternity services. And I'm deeply concerned at the impact that the current shortage of midwives is having on the outcomes for mothers and babies and their wider families. And I know that that pressure that is now being put, because Stroud maternity units obviously being affected by the shortage, and people are choosing to travel to Southmead, which many in my constituency already use, and I know that that extra pressure will then be making it harder for the staff there to deliver the service that people need. And being continuously supported by a midwife during labour can prevent a situation escalating into a dangerous one. And proper support after the birth, however it went, can set families up for the early months, helping mothers to recuperate, to establish feeding, to talk through concerns and to get to know their baby in a supportive environment. I think the Honourable Member for Stroud made a very good point about the importance of choice. I think there can be a sense that this is a luxury, that people are making these choices because they have an idealised view of how birth should go. But as my own experience demonstrates to me, the manner of the birth can have significant long-term consequences for both mother and baby. And so choice isn't a luxury. I think it's very important to understand that in childbirth, feeling comfortable, being able to allows the hormones to flow that will promote the best chances of a successful, uncomplicated birth, which is obviously the ideal. And so, and for some people, they will feel that comfort from knowing that they have the very, very best high-tech facilities on hand in case there is an emergency. For others, it will be knowing that they're in a familiar environment, whether that's their home or a birthing unit that they feel comfortable in. So I think choice is important, not because it's a nice thing to have for mothers. It's important because it has potentially long-term consequences for the physical and mental health of mother and baby. So I'm concerned that 2 years after the joint report on safe staffing from the baby loss and maternity or parliamentary groups, staff levels are still frequently inadequate. And we want to see a cross-government target and strategy led by the Department of Health and Social Care for eliminating maternal health disparities, providing guaranteed mental health support, and to have a new workforce plan backed up with adequate funding and an expansion of the maternity and neonatal workforce. Thank you.
Bobby Dean.
Thank you, Mr Chairman. I'd like to thank my honourable friend for bringing this debate forward. The experience that he and others have shared about maternity services in Gloucestershire have similarities to those in my own constituency. In Cheltenham and Wallington, the Epsom and St Helier Trust does have a good rating overall from CQC. However, its maternity services have recently been downgraded to requires improvement, and more worryingly, the safety element of that inspection had it downgraded from good to inadequate. A critical reason for this downgrade is the state of the building. It makes it hard for staff to perform their jobs efficiently and for patients to access the quality of services and, frankly, to have the comfort of using those services as well. The examples highlighted in the report included how the bereavement room was not soundproofed, the ensuite facilities had a shower curtain instead of a door, and at the time of inspection, the 2 operating theatres opened directly onto the corridor of the delivery suite and were not secured. And this obviously allowed that anybody using the service to potentially have the ability to gain access to potential deliveries and surgeries. A hospital building that is crumbling, where 3/4 of that building are not up to standard, where infection control is tricky because it's in cramped conditions, and the risk leading to tragic consequences for maternity care. This is an exhausting atmosphere for staff to work in and has led to low morale amongst staff. What we need very clearly is urgent investment in the hospital's infrastructure. Now, a new building was promised by the previous Conservative government, but so far it's turned out to be unfunded, and we are waiting to see what happens from the forthcoming review. I am due to meet with the Health Secretary in the next couple of weeks, and we're going to make clear that it's essential that we do deliver a new building for A&E, but also for maternity services, and preferably that site will be on St Helier. St Helier serves a densely populated area with greater deprivation levels and higher health inequalities. And these inequalities are particularly pertinent to maternity care. The building wasn't the only issue. I've noted some of the other honourable members' remarks, and the phone line was an issue, actually. So the honourable member mentioned before having that ability to pick up the phone and speak to somebody and get simple advice after a baby is born is critical, and that was not functioning properly in our hospital either. But the other point is the one that's been well made already around staff retention and recruitment levels. Similarly, our staff are hard-working, they are dedicated, they are doing their best, but they are under immense pressure, and it's leaving them feeling burnt out and fatigued. And at the bottom of this, there simply aren't enough staff members to go around. Now, the CQC report for St Helier Trust highlighted that the shortage of midwifery staff didn't have the necessary qualifications in lots of the key critical areas. And they further noted that not all staff have completed some of the mandatory training. Now, we've spoken to the CEO of the Trust about this already, and he explained that that's not because they weren't aware of that being a problem, it's because they are simply so stretched that getting the people actually through these courses whilst also trying to maintain a minimum level of care for the people coming through the hospital has just proved impossible. And childbirth, of course, waits for no one. And in this high-pressure life or death situation, it's a matter of just working with the available staff or having no staff at all. So if we can get the recruitment and training midwives right, then we can go a long way to solving this conundrum. The consequences of this understaffed and underfunded maternity care are dire. In recent years, there has been a stark increase in maternal mortality, rising from around 8 deaths per 100,000 to over 13 deaths per 100,000. And women from lower socioeconomic backgrounds and ethnic minority backgrounds are also disproportionately affected, being twice and sometimes 3 times more likely to experience maternal mortality, respectively. And those last statistics are particularly harrowing in a constituency like mine. It's an urban constituency where we have a higher than average number of women from both ethnic minority backgrounds and those living in more deprived areas. So improving maternity care must be a key priority for this new government as it seeks to address the overall crisis in our healthcare system. Giving birth has been one of the most dangerous and vulnerable medical procedures for women throughout history, and nobody wants to give birth in a hospital that is crumbling, potentially unsafe, and where there aren't enough qualified staff to help you. If the government is serious about improving women's equality and closing the gender healthcare gap, then the UK's serious decline in maternity care needs to be addressed. This is why the Liberal Democrats have called for the UK government to ensure that the commitments made in the workforce plan are backed by adequate funding and include expansion of the wider maternity and neonatal workforce. And in the meantime, I will continue to fight for the upgraded maternity services my area so desperately needs. Thank you.
Eddie Chambers.
I think one of the biggest problems that's come up time and time again in every maternity inquiry is that women aren't being listened to. And too many times their concerns about their care are dismissed. And this really does need to change. So we need to start prioritising the voices and experience of women if we're serious about fixing this crisis. And I touched earlier that I'm the Liberal Democrat spokesperson on mental health, and so I do need to mention the shocking statistic that, that suicide is now the leading cause of death for women between 6 months and 12 months, 6 weeks and 12 months after giving birth. And with World Mental Health Day being tomorrow, it's heartbreaking to think how many sort of new mothers must be really suffering without the support that they need. And we also need to recognise the financial impact on this crisis. The NHS faces a 21 billion maternity negligence care bill. That's money that should be going into providing maternity care itself. And when the negligence payout is 3 times the actual funding for delivering the care, that shows it's a system that absolutely needs resources being poured into it to ensure that we get that bill down and have it being used to deliver safe and effective care. In Winchester, people are particularly concerned about proposals to downgrade our consultant-led maternity services to one that doesn't have consultants and surgeons on site. And unlike my honourable colleague who's a doctor, I'm a vet, so I haven't got your experience, but I have done countless emergency caesareans, and I know that when something starts going wrong in childbirth, especially halfway through a birth, timing is everything. And the thought of people starting to give birth in Winchester and then having complications arise and then having to be transferred up to Basingstoke is understandably a concerning and terrifying thought for many people in our constituency. And so that's something we're fighting to keep maternity services, consultant-led maternity services in Winchester, because this was partly how the problem in Gloucestershire arose with the downgrading of services to other hospitals. I suppose maternity services and their safety, it's a concern nationwide, but including in the Hampshire Hospitals NHS Foundation Trust. In 2023, the Care Quality Commission downgraded the Trust's maternity services from good to requires improvement after they found serious safety concerns. Now, the amazing staff have been working really hard to improve, and I'm really pleased to report that they exited the Maternity Safety Support Programme in July this year. But there's still a long road ahead to restore public trust in these vital services. And I want to acknowledge the brilliant work of Winchester resident who is here today, Jo Cruz. She launched the Delivering Better campaign. And I'd urge everyone here who has obviously have a particular interest in maternity services to engage with that campaign and learn more from it. With her permission, she has shared with me her story, and I'll read it out now. So, my daughter's birth in October 2021 was the most terrifying experience of my life. I entered motherhood injured by a series of poor clinical decisions and deeply traumatized by a 3-day labour during which my calls for help and pain relief were repeatedly ignored or dismissed. The experience eroded my trust in the healthcare system I have always revered, pushed my marriage to the brink, stripped me of my dignity, and led me to develop suspected PTSD and many months of painful recovery. It has had a significant impact on how I feel about whether I will have more children. I cannot overstate how far the shock waves of that experience have extended in my life. I live with the knowledge that what has happened to me was not only avoidable, but is happening every day in maternity wards across the country. This is not an issue localised to a few ailing trusts. It is a public health crisis being allowed to unfold in plain sight. Thank you.
I call Helen Morgan.
Thank you very much, Sir Christopher. It's a pleasure to serve with you in the chair. And might I start by congratulating my friend, the Honourable Member for Cheltenham, for bringing this important debate, because maternity services affect every single one of us at least once in our lives. And it's important that we protect them to ensure that that moment for all of us, and obviously more than once for many of us, is a safe one. I'm not going to mention all the other honourable members. I'm very pleased to see so many of my Liberal Democrat colleagues here. They have all made excellent speeches and made very powerful points. But I particularly do want to thank the member for Thornbury and Yoke for sharing her experience, and the members for Gloucester, Tewkesbury and Stroud, and Tewkesbury for sharing their experiences, and obviously the member for Stroud has shared his own clinical expertise, which is very important. And finally, the member for Winchester for describing his constituents' shocking experience, which I think we're all upset to hear. This is not the first debate we've had on maternity services. It's not even the first debate we've had on maternity services this Parliament. And the reason is that they are being underinvested in on a shocking scale. A report was commissioned while we were in recess by the Care Quality Commission on the 19th of September, and its contents are hugely disappointing, if not at all surprising. As the Honourable Member mentioned, it speaks of the risk of normalising avoidable harm, and that is an unacceptable situation to be in. Now, honourable members may be aware that my interest, particularly in maternity care, came about because I am from Shropshire and I represent North Shropshire. And my constituents, Kaylee and Colin Griffiths, lost their daughter Pippa at Shrewsbury and Telford Hospital Trust. And they fought tooth and nail alongside Rhiannon Davis and her husband Richard Stanton to bring about the Ockenden review into the scandal that unfolded at Shrewsbury and Telford Hospital Trust. Since then, we've had another report on East Kent. There is a review going on in Nottingham. None of this is news to us, and it's shocking. I've sat on the APPGs for birth trauma, which was brilliantly led by the former member for Stafford, Theo Clark. I've been on the baby loss APPG. I'm currently trying to reconstitute the maternity APPG. And all of those groups have found the same failings over and over again. The CQC report tells us what we already know. 40% of maternity service are rated as requiring improvement, and 18% is rated as inadequate. And that means that less than half are rated as being acceptable. And it is not excusable, particularly when we've had so many high-profile scandals and so many commitments, which I believe have been made in good faith from the dispatch box, that this will not happen again. And it is happening again every single day. We know from all of those reports that unsafe staffing is at the root of most of these problems. And we know that unsafe staffing is pushing hard-working midwives in particular to the brink. They work their socks off, frankly, to share in what should be the most joyful moment of each individual's life. I know when I had my own baby nearly 16 years ago now, in an emergency situation, the midwife who'd been with me all afternoon stayed on at the end of her shift to make sure that I was okay and to make sure that my baby was all right. And we received excellent care, and we were both fine in the end, thank goodness. But we have relied so much on the goodwill of those individuals that they're experiencing burnout at an alarming rate. I was canvassing in my own constituency in the general election, and a midwife came running across the road, literally in her dressing gown and slippers, to tell me that she was emigrating because she'd had enough, and that 2 other midwives she knew in the county were taking the same step because they had experienced burnout on such a shocking level. And any workforce plan needs to be dealing with that problem very, very urgently. Unsafe staffing is one problem. Unsuitable buildings, we know, are another big problem. I think I read in the shocking inquiry into the Lucy Letby case in the Countess of Chester, which is slightly unrelated, that there was sewage coming up in the sinks of the Countess of Chester Hospital. You know, how can we control infection when there was literally raw sewage in the building? It's unacceptable. We need to ensure that this budget is investing not just in the GPs and the healthcare workers and the midwives that we so urgently need, but also in the fabric of our hospitals. We've also heard repeatedly that there is a failure to learn from mistakes when things go wrong, that hospitals are too focused on protecting their own reputation and not on learning from the terrible mistakes that might have happened, and that will inevitably occasionally happen even with the best staff in the world, because sometimes things go wrong. But they must be learning from those mistakes. And finally, that there is a failure to in hospitals for an open culture to exist, so that when staff have got concerns, they are unable to raise them. And to that end, I would urge the Minister to consider that the duty of candour law that the government has committed to is so important, but in hospitals, the people that you can speak up to are independent of the hospital manager and of the clinical director. Because if those people are reporting back in to the person who's responsible for giving you your job, it's not a safe process. We must have independent whistleblowing procedures for people who are raising clinical concerns. I'm sure that my constituents share my anger that we have to return to this topic again and again and again, when we should be looking at how far we've come since the Ockenden report was issued over 2 years ago. I do want to touch on the point that my honourable friend made about inequality in outcomes. Black and Asian women have a far worse probability of surviving their birth and that of their baby than white ones. And if that was happening in a single trust, we would be having another big important review into that issue. Because it's spread out across the country, the issue is being lost, and we must return to that issue, because it's not acceptable in this country in the 21st century that your ethnic background or indeed your social economic background is a determinant of whether or not having a baby is safe. We're not on track to meet our 2025 targets for reducing stillbirth and neonatal death, and those targets haven't been renewed. So I would urge the Minister to renew those targets and ensure that there's a plan in place to make sure that they're met. Finally, my honourable friend, the member for Winchester, made the very critical point that spending more on medical negligence than we spend on maternity services is totally unacceptable. And this country cannot afford for that to continue. We must make maternity services safe, because it is better for the mothers, it is better for the babies, and it is better for the taxpayer. And I look forward to hearing the Minister's response.
Caroline Johnson.
Thank you. It's a pleasure to serve under your chairmanship. Can I start by congratulating the Honourable Member for Cheltenham on securing this very important debate today. Childbirth is a really special event. It has been described today as the best moment of someone's life, and I think that's something that's often the description that is used. It's a special moment not just in the life of the parents and of course the child, but also the wider family and the wider friendship group. The birth of the baby is enjoyed by everybody. And I've been privileged to attend many births over my career as a doctor. Though, other than the birth of my own 3 children, these have generally been skewed towards those where things have not been going to plan. Not I should hesitate as a result of my presence, but more my presence as a result of the fact things weren't going to plan. The work of the NHS, its midwives, its obstetricians, the wider team that look after women and their babies, I think is by and large exceptionally good. But we do hear stories of where things go wrong, and we need to limit and minimise that as much as possible. Essentially, the talk of whether Cheltenham needs a midwifery centre or not comes back to the pull and tug that I've seen throughout my career between the centralisation and the localisation of services in general. When services are centralised, you can argue that there is an increase in expertise, there's an increased volume of cases, which make people more familiar with emergencies because they happen more frequently, and you can offer more specialist services for those who have high complexity and low volume problems. You can also have more support for staff because there are more staff present in the unit. But they can feel more remote, and for people living in rural areas, they can be too far away and feel too impersonal, particularly for such a procedure as giving birth. But things when you have a local unit, yes, you may feel more comfortable, you may know the staff, you may have a close-knit team. But as our veterinary colleague from Winchester so amply described, if things do go wrong, you can be a long way from the help that you need to receive. And so there is that balance and the push and tug. Now, as has been mentioned, choice is important, and women will make informed consent choices on where to give birth based on the information that they receive. But the Honourable Gentleman from Cheltenham, I think, has made a good case today for why the balance may not be as it ought to be in Gloucestershire, and that the government should look carefully at that. I was very sorry to hear of the Honourable Gentleman from Gloucester's experience with his newborn baby. It is, as a paediatrician, something I'm familiar with, that balance between the baby that has gone home and may have picked up a viral illness that's brought them back in again, the risk to the baby themselves from going on a children's ward where the impact of disease is more predominantly based in infection and infectious conditions than it is in older age groups and adult wards. But also the risk of putting the baby on a neonatal unit and introducing a virus to that unit that could make those babies that are already there so very unwell. And I think we need to think very carefully about a solution to that that's more so that people don't go round and round in circles, as the gentleman has described being passed from pillar to post, because I'm sure that was a very frightening experience for you, and I'm sorry that that happened. In terms of other issues that were raised today, the member for Stroud talked about community midwives and the importance of community midwives, and I still remember, even though my eldest is now 9, my eldest is now 17, my youngest is now 9, the midwife Marie, that was my postnatal midwife, and the care that she gave. And I think sometimes maternity care does focus a little bit too much on what's going on in the hospital, when actually what happens in the community is also very, very important. The member for Thornbury and Yale suggested that we could have a midwifery inpatient unit with mothers and babies and only one member of staff. I'm afraid I don't agree with him on that. And the member for Winchester raised the concept of two simultaneous emergencies. And of course, if you've only got one member of staff, how do they go on a break? What if they're in the bathroom when you need them? I think I don't really agree with that. I think if you have a unit, you need to be able to have, unless it's attached to a major centre with more staff, you need that second person. As of December 2023, there were 2,361 full-time equivalent midwives, working in the NHS trusts and other core organisations in England, and that actually is an increase of 3,707, or 18.9% since 2010. Now, on the one hand, the birth rate is falling and the number of midwives is rising, but I do recognise that the births that are taking place are more complex in some ways than they used to be. And at the spring budget this year, there was a £35 million further investment to improve maternity safety over the next 3 years. That included £9 million for brain injury. Now, I did ask the Minister at the last debate we had on maternity safety, which was on the 4th of September, whether she would commit to that money being spent, and I haven't received an answer. I asked her a number of questions at that debate, actually. I asked her if she could confirm that the government would proceed with the fortification of folic acid in bread products to protect babies from spina bifida. I asked her about the non-essential communication budget. As the Chancellor had said on the 29th of July, the non-essential communications budget would be essentially cut. Whether that was affecting public health budgets, because public health budget is very important, particularly in terms of public health messaging around chronic illness and optimising chronic illness and conditions such as diabetes and obesity before conception. But I haven't received an answer to either of those questions. I also raised the NHS bundle, which was due to be updated on maternity early warning scores and tracking tools, to ask her if that was itself on track. Again, she hasn't written to me as promised with the answers to that question either. I asked if she'd be supporting the HSIB I also asked about the £35 million budget, which I just described, and I haven't received answers to any of those more than a month later. None of my staff can find any correspondence from the Minister, and I'd be grateful if the Minister could answer those questions today, or at least commit to answering those questions by the end of the week, please, because I think we have waited quite a long time. The final question that I asked the Minister last time was about the group overseeing maternity services nationwide, because following the East Kent report, and I was the Minister when that was actually published, Dr Kirkup's recommendations were accepted. Maria Caulfield, who was then the Minister for Women's Health, she set up a working group which she chaired as Minister, to review the work being carried out by a whole range of programmes to improve maternity care and improve neonatal care and implement those recommendations. And I asked her if she could guarantee that that work would continue and who would chair it. And again, I still haven't received an answer. So I think it would be helpful for the Minister to answer the questions from the last debate and as well as the ones from this. Thank you.
Minister. Thank you, Mr. President. It's a pleasure to serve under your chairmanship. And with your leave and the leave of this debate, if I can just start by a few words to mark Baby Loss Awareness Week, which we have this week. Many mums and dads across the country have suffered the heartbreak of losing a baby, as we know. Now, everyone deals with grief in different ways, but it has been moving to hear from some parents how baby loss certificates have allowed them to process what they've gone through and help give them closure. That's why this week we've launched an extension to the Baby Loss Certificate service, a voluntary scheme to enable parents who have experienced a pregnancy loss to record and receive a certificate to provide recognition of their loss if they wish to do so. Until now, in order to get the service undergoing, it was only open to parents before 1st September 2018, but today we're removing this restriction, making the certificates available for every parent that's lost a child, and we will update the House with a formal written statement shortly. This government is committed to delivering compassionate care for women and support for parents who've suffered a baby loss. It is the right thing to do. So, Christopher, when I say this has been actually genuinely a very good debate, it's been one with both experts, and I commend the opposition spokesperson and my friend the Honourable Member for Stroud for the work that they do in that, and experience shared. And in that regard, I knew the Honourable Member for Cheltenham would be bringing forward good points too, and I contacted the Trust myself so that I could give the Honourable Gentleman and members present my frank assessment of what's happening on the ground. Now, as has been said, but let me reiterate, as of August 2024, the midwifery vacancy rate in the Gloucestershire's Hospital Foundation Trust stood at 13%, which is the equivalent of 32 full-time midwives. Now, this level is high for the South West, although roughly in line with the national average. In April 2022, the Care Quality Commission gave the Trust that warning notice for maternity and rated it as inadequate a year later. And in May this year, as we've heard, the CQC issued that Section 31 notice, a severe warning that requires, at minimum, an immediate action and improvement plan, which, as colleagues will know, in some other settings could result in a closure. They did this after seeing postpartum hemorrhage rates, poor fetal monitoring and high levels of agency staffing. So the Honourable Gentleman and others from the area are right to be concerned. We all agree it's unacceptable when new mothers don't receive the highest possible standard of care. And as my right honourable friend, the Secretary of State, has said, we should be honest about the problems in our NHS and serious about fixing them. And maternity services are very, very far from where we want them to be today. Childbirth should not be something women fear or look back on with trauma, and safety is obviously paramount. And as the Honourable Member for Cheltenham said, it should be that special moment. And I can thank the Honourable Member for Thornbury and Yate for sharing her experiences. For myself, my first child, I was in hospital for 2 weeks after that. It is a traumatic time, so the length of time that she shared with us is really, must have been very, very difficult. My first came out so quickly, I was in and out of hospital before we knew it. And my third child, just as it has been mentioned, was almost delivered at home by my husband, having decided for a home birth. He's not medically qualified. And can I tell you that the sound of the doorbell ringing with the midwives arriving was the best sound I've ever heard in my life. Now, the Trust are taking steps to improve the situation, which I will just outline in response particularly to the second question asked by the Honourable Member for Cheltenham. This includes a new Director of Midwifery, an education and training midwife, and a perinatal quality and governance lead. To improve retention, the new leadership has introduced a retire and return scheme and is holding monthly events for senior leadership to listen to staff and address their concern. They have recruited 33 new midwifery starters since September 2023, including from overseas. 10 midwives are due to start this month, with a further 10 expected in January, but there's still a gap. That's why the Avita birthing unit in Cheltenham and the postnatal beds at Stroud Maternity, to answer the Honourable Gentleman's first question, will remain temporarily closed until they reach those safe levels of staffing. The Trust clearly felt they could not continue these services without putting new mothers at risk, which is an impossible situation for them to be in. I am pleased the birthing unit at Stroud does remain open, but of course these other closures have had an impact on women, their families and the local community, as I think eloquently expressed by my honourable friend for Gloucester indeed mentioned by the honourable lady for Thornbury and Yate. The impact on that goes further afield to my own city of Bristol. In addition to these measures, the Trust is also developing new apprenticeship schemes. They're building new partnerships with universities, including Worcester and Oxford Brookes, and they're launching a midwifery attraction campaign in the autumn. And while they've had positive feedback from last year's new starters, I'm pleased they're carrying out regular assessments as per the recommendations in the Ockenden Review to make sure midwives have the right skills to serve the people of Gloucestershire. The turnover rate is now settling, and I know the Honourable Gentleman and other colleagues will do everything they can to help convince midwives that his county is a great place to live and work, and the passion for those units is very evident here today, and I'm sure that will be welcome to those trusts. Now, I know from my own career in the NHS, these changes do take a long time. It's too soon to make an assessment until all of the new midwives have started. However, we're not waiting for the CQC to do the rounds to make sure the picture is improving. The local maternity and neonatal systems team and the regional NHS England team are meeting with the Trust on a fortnightly basis to review progress. And the Trust's monthly board reports will report on progress as well. I know honourable members present will be watching that carefully. It is important to give the new team some space to prove themselves, and I'm hopeful we will see improvements in time. At a national level, whenever trusts and maternity units don't perform on our watch, we will steer them back to safer ground. That's why we're supporting Gloucestershire Maternity Services through the National Maternity Safety Support Programme, and means the Trust is supported with Maternity Improvement Advisor for both midwifery and obstetrics, who helps the Trust to embed their maternity improvement plan. Now, I know the Honourable Gentleman and others will continue to hold the Trust to account until it's delivering for women in their constituencies. And I am grateful for him bringing this debate here to us today and for giving us the chance, me the chance to put the government's position on the record. With regard to his third question, just to outline, the Trust, like many other trusts in this position, does have the budget for establishment. It's the recruiting and retention of the midwives that is the issue. I know some trusts do different things with incentives. I don't know if they are particularly doing that, but that may be something he wants to pick up with them at another time. On more general maternity improvements, Sir Christopher, back in September, the CQC published a report that demonstrated just how much the previous government let down new mothers in this country. And Lord Darcy's report has shown that despite some improvements, there's still a disgraceful inequality of outcomes, and we've heard this today again for black and minority ethnic women. We will look at every recommendation in the CQC report, and if officials object to any of the recommendations, I would expect to hear a very good reason why. There is currently ongoing work to improve maternity and neonatal services across England. The NHS put in place a 3-year delivery plan to make maternity and neonatal care safer, fairer and more tailored to every new mother's needs. With regard to the government's wider ambition, choice, which has been mentioned today by the honourable members for Stroud and for Thornbury and Yate, is absolutely, for us, a key part of maternity care. And our NHS must be listening to, as the honourable member for Winchester said, and working with women and families in relation to the way their care is planned and received based on what matters to them. Now, to get the maternity back on its feet, we do need to train thousands more midwives as part of the NHS workforce plan, while encouraging experienced midwives to stay in the NHS. And many honourable members, including the honourable member for Cheltenham, spoke of the situation with recruiting midwives, with regards to morale and workload, also mentioned by the honourable member for Tewkesbury and for Carshalton and Wallington. The NHS will deliver the people plan, giving a stronger focus to modern, compassion, inclusive culture, and absolutely has to be part of our forward look in the 10-year plan. We will ensure that trusts failing on maternity care are robustly supported into rapid improvement, and we are setting an explicit target to close the Black and Asian maternity mortality gap. NHS England is on the right track, boosting the workforce through training, apprenticeships, postgraduate conversion, return to midwifery programmes and international recruitment. I've been clear the government will build on these programmes, not replace them. Now, finally, Sir Christopher, I want to end by restating our unwavering commitment to maternity services across the nation, including in Gloucestershire. We are actively working to improve staffing levels and are planning for the future needs of Gloucestershire's maternity services. I say to his constituents, I hear his concerns. I completely understand them, and I will work with the Honourable Member for Cheltenham to set this right. And can I give my apologies to the opposition spokesperson? I have answered a number of, she's an assiduous writer, which is absolutely right. I have answered a number of her letters, but if I haven't responded to those particular points for the last debate before recess, I do apologise, and I will make sure that that happens following this debate. It is important. She has raised important questions. In both the Honourable Member's constituency and in mine, women have had to bear the brunt of inaction for the past 14 years. But this government will deliver for women, not just in the South West and in the country. Thank you.
I call Max Wilkinson to respond to this very well-informed debate.
Thank you, Sir Christopher, and I will start by apologising to you, Chair, for misaddressing you in my initial representations to the meeting. Thank you to the Minister for a long and detailed reply, and I really appreciate the time that she's taken and also her background in the NHS. We've spoken in other places about how you've worked in the NHS for a long period of time, and I know you'll bring a lot of expertise to the brief. And I also appreciate the specific references you've made to the constituency and the work that you've done to make sure you were able to give the detailed response about Gloucestershire's services today, rather than just a more general response on the national picture. And I think that's brought a lot to the meeting. So we've heard some very powerful contributions, not least the contributions made by the member for Thornbury and Yate, who told her own personal story, but also the contribution of a member of the public via the Honourable Member for Winchester, and also the contribution from the member for Gloucester, who had a harrowing few days, by the sounds of it, with a really good outcome. And in his maiden speech the other day, we heard references to his son as well, and that was really joyful, so thank you. The Gloucestershire example, of course, is not alone, as the Minister has pointed out, and others have pointed out indeed. And we suffer in Gloucestershire, however, from an outsized problem. Clearly, in our region, we're suffering in a way that other NHS trusts are not, in terms of the deficit of midwives, and that is something we need to address. The Minister referenced the good work being done already by the Trust, and it's important that in our contributions we recognise that work is being done under new leadership to try to turn things around, and in my regular meetings with the Trust Chief Executive that really has come through, and an open and transparent culture to communications, I think, is something that we will welcome as new Members of Parliament. But at its heart, this discussion must come back to the safety of women and the safety of babies, and to choice for mothers. At the moment, we're suffering locally the symptoms of a problem which is a widespread national issue, as we know. But it is not acceptable for that denial of choice to remain in Cheltenham and in the rest of Gloucestershire for an indefinite period of time. And that is what we are currently dealing with. I would urge the Trust Chief Executive and others. I know they're listening to this debate, and they know that we are contributing in good faith. I would urge them just to keep members of the public and everyone else, particularly those local MPs and local councils, informed about what is happening next. We know that there is not going to be a decision before April 2025. However, it is important that there are milestones so people get updates, and there's regular reporting in an open and transparent way, which helps to retain confidence in a system as the good work that is going on to support the rights of mothers and babies and families indeed, but also to make sure that our midwives are better looked after in the system. If we can keep this debate happening in public, I believe that we are more likely to get to a situation where Gloucestershire families are getting the service from the local NHS that we all deserve. Thank you, Sir Christopher.
The question is that this House has considered maternity services in Gloucestershire. As many others can say aye. Contrary no, I think the ayes have it. The ayes have it. Order, order. I'm conscious of the fact that the next debate is scheduled to start at 4 o'clock, but since the member who is going to be moving the motion and the minister are already present, it would be my intention, unless there's any objection, to allow that debate to start immediately. Is that agreeable to the minister and to the member in charge?
I think possibly, because it's Tuesdays and Wednesdays rather than Thursdays, I think possibly it does need to start at 4. Yes, and I think
Because I understand that there may be somebody else coming who wants to participate and they think it's going to start at 4, the sitting is suspended until 4 o'clock. Order, order.